Welcome. We're here today. The Healing Forum presents Dr. Rosemarie Allen and myself, Dr. Nene Chung. And the topic of the day is healing emotion with acupuncture. So it's really fascinating. I want to introduce Dr. Rosemarie, and we've known each other virtually for about a year and a half, I'd say. We started through a women's group called Emerging Women Plus. We've co-authored a book together. And I'm really happy to have you here, Rosemarie. So
Thank
you're
you.
a doctor of acupuncture, and you're in Jacksonville, Florida, and let's talk a little bit about what you do and how long you've been doing it. So you want to give a little
Okay.
introduction to yourself?
Yes. Thank you so much for that introduction as well, too. Yes, I am originally from Jamaica and live in Jacksonville, Florida. I am an acupuncture physician and have been doing that for going on 18 years, a physical therapist assistant for about 25, massage therapist for about the same, and a certified health coach for probably about 3 years. And so I combine all of these things and practice from my own practice in Jacksonville called A Balance to You Acupuncture and Wellness Center, located here in Jacksonville. So that's what I do on a regular basis.
I love that. I love that. Wow.
Mhm.
A lot of years of training goes into it. And I know because I've been in private practice as I started as a chiropractor. Starting with art and sculpting, went into
Wow.
shiatsu, wound up
Yes.
getting a bachelor's in literature, liberal arts, and then on to chiropractic and then a master's in nutrition. So,
Yeah.
and the work that I do is body, heart, and soul healing. So,
Right.
I feel that affinity
Mhm.
with you because we're talking about
Yeah.
acupuncture, which is a
Yes.
physical um,
Hmm.
medicine, and then going into the emotional. So I
Right.
discovered years ago that when I was working with patients doing detoxification programs, how important the emotions were linked to any physical
Yes.
issues. I'm sure you've seen
Yes.
that.
More
Before
and more. Yes.
I had no idea
Hmm.
there was such a close affinity with emotion and what I call spirit or soul
Hmm.
and physical entity. So, how have you seen that in your practice?
Amazingly well. I've seen so many different ways happening. And if you really think about Chinese medicine, what it focuses on is mind, body, and spirit. So you can't really fix the body unless you're fixing the spirit and the mind as well. Something physical happens, it's going to affect the emotions as well, and likewise, vice versa. Things can
Right.
affect the emotion from internally, things that you have on your head, your mind. Something from externally can affect you as well, to which cause an internal interruption as well. And so all of it plays together. So in order to truly heal the body, you have to look at all aspects of healing, looking at the big picture,
Right.
which is mind, body, and spirit. And that's how I treat my patients,
Yeah.
and seen a lot of amazing results by doing that. And one of the things I've found too is that when people come in and they complain, a lot of times they're complaining about things that's happening for them physically. However, it has an emotional background. If there is something going on that's unsettling, not taken care of emotionally, it will start affecting the body from a physical perspective. And I've seen it over and over again.
Yeah.
And treating
The
that is
trauma
really
really
truly
resides.
the emotion. Yeah.
Yeah. And the
In order
trauma
to
then
get to the
resides
bottom of it
in
is
the
really
physical.
treating the emotions. Yeah.
Yeah. Yeah. Interesting. And it's so different between the Eastern medicine approach and the Western medicine approach. Unfortunately, in Western medicine, we segmentalize everything, and so
Right.
we have doctors that just look at the eyes or the ears
Right.
or the heart or the
Right.
toes or the hands. And so, I mean, I remember years ago taking my mom to a doctor, and she wanted to check her blood pressure, and he said, "Oh no, I don't do that." I was like, "What do you mean you don't do it?" "Well, I'm
Right.
not a cardiologist. I'm not an internist." I was like, "Well,
Hmm.
every doctor is trained to take blood pressure, but he just would
Yes.
not step outside his mode of practice or his specialty."
Yeah.
And so I
Mm.
think that's what's really happening. And that's why I think that really the true focus of healing is looking at the whole person, the whole body,
Right.
and being more of a patient
Exactly.
centered diagnosis rather than just looking at the isolated parts, because the body as a whole, the blood system goes throughout the body, hormones run throughout the
Right.
system, the circulatory system, the lymphatic. I mean, every part of the body speaks to the other part of the body.
Exactly.
Yeah. So interesting.
Yeah.
So tell us. I mean, what would be then your approach to assess a patient coming in?
So when the person first comes in, we do what we call an acupuncture evaluation, right? And the evaluation consists of the person's medical history, whatever has been happening to them, what their complaints are, and then it also incorporates looking at their tongue, which is the tongue is a diagnostic tool in Chinese medicine where we can look at the tongue and tell what conditions the organs are, the organs are performing in. And then we also check the pulse. And the pulse that we check, it's not like looking at the pulse of the heart like Western medicine. We're really checking the characteristic of the energy from each organ.
Right.
So when we're checking it, we're checking for different things we're feeling under the fingertip, which usually correlates with the tongue and correlates with what the patient is saying. Now, sometimes
So
if the
you're looking
patient is
really
not
at
being
I'm just going to interrupt you. So you're looking at the meridians on the pulse, right? Don't you use 3 fingers and then check
right, the 3 fingers, and we do it like this.
Yeah.
And
So
then
it's
we're
very
feeling,
sensitive.
I'm trying to do it like this, yeah. And then we're feeling for what it feels like on the underside, on my fingertips, what the because each of those sensation that I feel, it has a different indication for different things, different
Right.
organs, and it usually
What prescription have you
correlates.
used for that? I mean, I know it's thready. Isn't thready one of the diagnoses? You feel
Yes,
it.
thready, slippery. You can have deep, you have weak, you have empty, you have deficient, you have excessive. There's all these different characteristics that you can
Right.
find on the pulse.
Yeah.
And
Very
yeah,
different
so
than
those
looking
and
at
it's
heart.
a similar thing with the tongue.
Yeah.
It's similar with the tongue because when we're looking at the tongue has organ representations on it as well too. So depending on what areas of the tongue you're looking at, the person's issue will present on the tongue as well too. And it will present in way of maybe the tongue being swollen, that you'll see in teeth marks on the tongue. That means the tongue body has too much water and it presses against the teeth and it gives those little indentation on the sides. We call scallop sometimes, but that's is present. Then you'll have the coat will be discolored when a regular normal tongue body is pink in color, a pretty pink with a very thin white coat. That's a normal tongue. When the tongue is out of balance, with whatever's going on internally, the tongue body changes. The color changes, the size of the tongue changes. We also look at the coat itself because the coat also takes on a different color. And the location of where the cracks, if you have cracks, you sometimes have lines, you have tremoring on the tongue. All these different things are indicative of what's going on. Dots, spots on the tongue are indicative of what's going on internally. So it's more than just looking at the tongue for tongue's sake. We also look at the fluid at the tongue because if the tongue is too dry, if the body's too dry, it will tell us the body's dehydrated. If it's too wet, there'll be too much fluid in the mouth as well too. So all of these things are indicative of what's going on internally.
Right. Yeah. Yeah.
Yeah, and
Multiple layers.
certain emotions also present on the tongue as well too. So yeah.
What would that be? What does that look like? Emotions showing
So
up.
like for someone that's going, like say for instance, I'll use stress because we have a lot of stress going on now and mental health stuff going on with the era that we're living with. And so we'll see tremoring on the tongue. And that in Chinese medicine, that's called a wind condition because the wind is movement. And so this would be called like a wind, like a liver wind. The wind is rising and it comes up. And so it affects the brain. So people they don't think well because they're so stressed, they're overthink or they lack of concentration and focus. All these different things happen. And it also presents on the pulse as well as the tongue. So with the tongue, it would be like the pulse would be like thin and wiry type of pulse or a tight pulse. They're different characteristic, like I said. So all of these
Right.
things are indicative of that. But the higher a person's stress is the more it throws off, especially the liver and gallbladder channel. Because if you think about it, in Western medicine, when someone is under a lot of stress, the liver, it produces more cortisol in the system, right? And it throws everything else off. All the other hormones are thrown off. So it's the same thing in Western medicine, but rather than saying the cortisol, we call it the chi because all of these energies have chi that go through it, which is the energy that transforms, everything that's happening in the system. The processes that goes through the system is happening through the energy.
Right.
And one of
So
the
stop a second.
baseline is
The chi energy is just the universal energy within the physical
exactly
space. Just chi
in
energy.
and out. It's the life force of all living things.
Right.
the life
Yeah.
force of all living things.
Life force.
But a
Exactly.
thing to remember is that the energy and the blood works together. They're codependent. The blood cannot flow without energy. The energy cannot
Right.
flow without the blood. So they're codependent on each other in order for the energy to move and the blood to move.
So is it the same? Oh, you talked about wind energy. So what are the different energies that the Chinese system works on? I know there's earth, there's fire, there's wind. So what would be
Then water.
the
Yeah, the
water?
main ones five is earth, fire,
We call them
water.
elements, right? The five elements,
Yeah, like
the
the
five
five
elements.
elements. Yeah.
Yeah.
So those are the five elements that it works on. And
So do
then the
again, earth,
emotions also
fire, earth, fire,
earth,
wind.
water, fire. My gosh, Nene, I can't remember them all right this minute now. Yeah, earth, wind,
Air,
fire,
wind.
air. Yeah,
Right.
yeah,
Yeah.
those are the
Okay.
five.
Yeah.
So, yeah. So with that said, everything works in each with each other. And a good way that I always use an analogy for acupuncture is using the wind, because the wind is energy and you can't see the energy of the wind. You can only feel the effects of the wind. You see the
Right.
tree moving. That's the only way you know the wind is blowing, or it blows against your skin and you feel it, right? And that's the only
Right.
way that you can really know that the wind is. And it's the same thing with our meridians. It's you can't really see it, but it's there. There's a map that indicates that it's there. That's how I'm able to find the points that we use to fix the body when the body's out of balance.
Yeah. Yeah.
Yeah.
So that's amazing. So using different tools than Western medicine, you're looking at things like the tongue. I mean, traditional Western doctors will look at the tongue, but it's basically just to see, is there yeast? Is there fungus overgrowth? They don't go into such detail about it. I mean,
Right.
it doesn't look so healthy. You look like you're sick, but that's about as
Yeah.
much detail I think as you get from them.
Yeah. And have you
And
say,
then,
ah,
right, are your tonsils swollen? Is it red? Is it inflamed? Is it strep throat? And then if it's not, okay,
right.
you're fine. Yeah,
Yeah.
yeah. So there's the much deeper level of detail
Hmm.
analysis with it.
And I think that's why it works so well, because we're looking at the big picture, not just the one thing that a person comes in with or their issues. We're looking at the big picture because it all relates to each other.
Yeah. I know when I see patients, I'll say, if they haven't been feeling well, I'll say, when was the last time that you actually felt healthy and alive and vital?
Hmm.
Because, and we go back and then I trace it from that point forward. Well, what happened in your life? What was there an emotional issue? Was there a tragedy? Was there some kind of stress? Was there a physical illness? And so, the history takes that much longer because you really want to retrace those steps. And I
Right.
oftentimes see that there's an emotional de-stress or stress or dis-ease,
Hmm.
we'd call it.
Right.
There's some trigger mechanism that has happened to create that roller coaster effect where they're now in a downward spiral. So
Yes.
the emotions really, and sometimes it's, you'll see like patients have been in an accident and then that accident seems to recur. Like every year, there's another
Right.
accident that happens. And I think,
Yes.
that
And I
makes
have a
more
patient that I
sense.
was working on with similar thing too, with emotions as well too. And it would every year it exacerbate around the same time until we got to the bottom of it. She could never get that thing fixed. No matter what she did, she wasn't able to get it taken care of because they were
Right.
treating it from the wrong perspective.
Exactly. Yeah. Yeah.
Hmm.
Really looking at the patterning of what's the trigger. And it can be an emotional trigger. It can be a physical trigger. It can be a psychological trigger. So really going more into depth with all of that, because it's true. If you're just like
Yes.
throwing medicine and pills, well, I mean, what really got me interested was that I was in a car accident in 18 and
Hmm.
I had, really severe whiplash and headaches every day. So even if I put a very light shirt on, it would trigger like muscle spasm. And I went for a
Wow.
year to the orthopedic surgeon. And he said, you've got 15% loss of motion in your neck. Here's Darvon. And I was like, I can't take that. It makes me so sick and nauseous. I'm not going to live on, painkillers the rest of my life. There's got to be something else. He said, no, you just have
Yeah.
to live. And that was like, boing, a trigger in my
Yeah.
head. And I mean, now I was 19. I said, I wasn't born with this. There's got to be a
Yeah.
better way. So,
Right.
yeah, interesting how, certain things in
Hmm.
my life have triggered me to understand and to learn, different aspects of what real healing is about. And also
Mm-hmm.
just looking at the perspective of what healing is. It's just not the absence of disease, is it? It's to be
No,
alive
no,
and vital and active and kind of happy and
exactly,
right. Yeah.
exactly.
So what else would
Yeah.
you use in terms of, I mean, once you've made a diagnosis, like how would you use acupuncture for emotions?
Okay, so once I diagnose the issue, then I explain to the patient about acupuncture, how it works. I show them the needles, because most people, the concept of needle, they're thinking about injection needles when they hear needles.
Right.
And when they see that, they're like, that's it? The needles are so
So
tiny.
fine. It's so
And yeah,
tiny.
they're really, really tiny. So when I put the needles in those points, I usually find points that are related to the organs, that's related to the issues that they're having. So depending on
Right.
what the diagnosis is, that's how I select the points that I
Right.
use. So say
And
for
let's just
instance, somebody
establish that
again,
there are meridians or energy lines in the system. So you're working along certain meridians. Just explain that a little bit.
yes. So the meridians, they're all over the body. I should have brought my little doll that I could show you guys, but it's in the other room. But they're all over the body and they're related to every living things has the meridian because of the fact that how the energy flows. Animals have it, humans have it, and they're all from head to feet. So you have six primary ones in the front, six primary ones in the back, and then you also have deeper ones that you can only access by way of the primary meridians. They don't have their actual points out. So you have to know what points is the interacting points, that you can get to, like an intersection, that you can get to those meridians, depending on what you're working on. Yeah. So
Yeah.
they're all over. So you have meridians in the head. So I do a lot of work on the head as well too, because even for treating the emotions, there's a lot of points on the head that I use. On the hands and the legs. So most of my points, I use a lot of points when I'm working because I do the head, the shoulders, the arms, the legs. Sometimes I'll do the tummy, depending on what the issues that I'm working on. But for the most
Right.
part, I use just the arms, the head, and the limbs mainly. Is where we put the
Yeah.
needles.
Yeah.
And certain
I was
points are,
always fascinated. Yeah. I was always fascinated looking at the meridians because again, I didn't study acupuncture, but I studied shiatsu, which is
yes,
touching the meridians, like with your hands
yes.
and
Hmm.
using that as a treatment. But I was always amazed when I actually went on to study, go on to study pre-med and looking at the vascular system and the cardiovascular system and the neurological system, how much it correlated the meridian system with the actual, as we know in
Right.
Western. I mean,
Yeah.
the nerves and the spinal nerves and the, cranial nerves and all of that,
Hmm.
like what correlation. And from what I understand, the Chinese never did autopsies, so they didn't really
No,
know. I mean,
they
we
didn't
did
know.
American, Western
Yeah.
medicine did autopsy so that we could actually see internally. We'd cut open the cadavers and
Hmm.
know where the nerves pathway went, where the vascular
Right.
pathway went, the circulatory system. But the Chinese really didn't do that. They didn't really
Yeah.
the
That's
physical
the
path.
amazing part about this
Yeah,
too, is because when you look at old ancient drawings, they came pretty close to what the real one was.
yeah.
Really, really close. And you wonder, how would they know all
How
that?
do they
And
know?
then knowing too that the meridians, they don't have a pathway that you can actually visually see, but it's there because it's energy. You can't really see it. But for them to
Yeah.
map it out, and I think that they found an ice age. Have you heard about the ice age man that they found in the cave? Ice age, that had the meridians tattooed all over his body.
Oh no, that's
This was
fascinating.
a few
We need
years
to know.
ago. They found
Oh,
it, and this was like thousands of years. This body has been in ice, somewhere in one of those mountains, and they found it. So
right, right.
yeah, so to know that I guess that's the way that they would figure out what works and what didn't. The body was tattooed. They used a tattoo to map it. I don't know
Yeah,
how they did
fascinating.
it, but I'm so glad that somebody figured it out because now I use it a lot to help other people.
Yeah, yeah, yeah.
I always
It's
say I
like
don't
the
know how
old,
they did it, but I'm sure glad they did.
right, right.
Yeah,
Well,
so
it's miraculous. It's really miraculous.
mhm.
My daughter had surgery this year, and she got so ill. It was a 7-hour procedure, but she got so ill from the anesthesia. And I said, "Don't
Yeah.
you have any acupuncturists here to help so that she doesn't have to take medicine for the pain?" And they said, no. I was like, you need to get to the 21st century. I mean, acupuncture's been around for
Yes.
2,000 years. You know, I've seen on television, on the Discovery Channel, I mean, all the, you know, in China, like how they use acupuncture for within the operating room to
Right.
sedate. So maybe they still might need some anesthesia, but,
Mhm.
you know, hopefully much less of it. And I
Yeah.
thought we need to really merge these ideas together and really come up with this magical solution to
Mhm.
pain. I mean, you know, we're facing the opioid epidemic because of people just getting addicted to the pain
Right.
medicine. Unfortunately,
I think
doctors
that's one
prescribe
of
it.
the reasons. Yeah. I think that's how acupuncture actually came to the Western world too. Was that one of our presidents went to China for a summit or something many years ago and had
Yeah.
appendicitis and had to get
Oh,
surgery, and they did the surgery without anesthesia, and he was amazed and shocked that he was getting the surgery. It was live, nothing. He didn't feel anything, and then when he
yeah.
came back, he started talking about it, and that's how acupuncture actually got a big push or a big boost back
Right.
in the day. This was a
Yeah.
long time ago.
Yeah.
So yeah,
Well, we certainly, I mean, it's kind of in the forefront, but you don't see acupuncturists in hospitals. I haven't seen any. Have
right.
you? I mean,
Not too many, not too
not too
many.
many. Yeah. Yeah.
And then also now with regards to the emotions now, each emotion has different organ that it represents. And then I'm gonna do is just like talk about the different emotions and what organ they represent and what are the indications that you'll see. So I'm gonna look at my little note here because it's a lot to remember. So first of all, there's the joy. Joy is the emotion of joy, which is affects the heart, right? And so for somebody who has too much joy, it can also be a problem. The trick here is balance. Under or over can be a problem. You just have to have the right amount, right? So what joy consists of is an excess joy affects the heart, but it can also have lead to sorrow, depending, right? So what joy does, it allows the chi to lead. It leads the chi, and sometimes people, if they have too much, they will get like a heart palpitation. They will get insomnia, poor concentration. They also will come up with mania or mania, or they can also have a heart attack. All these things would be an excess of the joy emotions. So
Right.
the goal is to try to maintain that. Have you ever heard of somebody like winning the lottery and got so excited that they end up having a heart attack too? Because the similar thing too, would happen.
Right.
And then one of the ones that I work the most with is anger frustration, that emotion of anger and frustration, because there's a lot of people that go there. Our life right now in the United States, there's a lot of anger, stress, emotions that's all thrown off because of either your lifestyle, your job, the economy. All these different things affect the body. So with anger, the one that the organ that one affects is the liver. When the liver is out of balance, it presents with all different things. You'll get like bloating and gas and belching and burping. You'll get acid stomach sometimes. High blood pressure will also, it will raise the blood pressure because the liver energy comes up, it ascends. And so it ascends to the head. So people also get kind of like, depression and sadness. All those things will start affecting the body. When the anger is out of balance, it makes the chi ascend, and it can cause headaches, dizziness, blur of vision. It can cause raise the blood pressure. Like I said, stroke. That's another thing too. Stroke can also be caused from that internal wind, was what I was telling you about earlier with the wind movement, which can also
Right.
be presented in seizures. When somebody has seizures, they have a lot of movement, so that will be the wind. And also painful menstruation and PMS and shortness of breath. And the link between the PMS and the menstruation is because the liver, according to Chinese medicine, creates the blood for the menses. So that's where it comes from, that
Right.
connection.
Well, because the liver
And
is
so,
one main responsibility is making red blood cells in the liver. So it kind of
right,
correlates. Yeah.
exactly. That
And
too.
then,
Yeah.
old Western, they used to call it like having bile, like green bile, like you were so angry, like a bilious personality,
Right.
anger
Yeah.
and
Yeah.
agitation.
Yeah,
Yeah.
and that's the color of the liver too. It's the green too. The bile is green. Yeah, so each
Yeah.
organ too has its own color as well too that represents the organ. And then the next thing now, when the liver gets too full, because then it creates a domino effect on other organs, right? So once the liver gets too full, like hyper extended, it rolls over into the digestive system. So what you'll find a lot of times, people who have a lot of anger or stress, they'll also have digestive issues. So they will always,
Right.
sometimes they'll have acid reflux all the time. They'll have digestive discomfort, diarrhea, or constipation, because what the liver energy is constraining, so it holds things in, right? So what you'll find that people also will have constipation, just like you're holding in, you're not letting go. It's the same thing that's happening with the bowels as well too. So with that
Yeah.
said, when you go into the digestive now, that's a different emotion now. It switches now to worry and overthinking, which affects the digestive system. And with that now, it affects the people who have that. They worry a lot about different things. They experience a lot of digestive disorders that will come along with it. And the worry stagnates the chi. It creates like a knot in the stomach. So people sometimes will get that sensation that there's like, like you got a burp and you can't burp, or there's a lump in your throat and you can't get rid of the lump in your throat, all of these things. And it depletes the blood and can lead to spleen chi deficiency. Now, spleen chi deficiency is like where the chi of the spleen and the stomach, it works together. If the chi is deficient, then it can't perform the job that it's supposed to do well, because there's a deficiency in the chi. So the goal of the treatment would be to increase or tonify the chi. Same thing with the liver. When the liver is off, because if the chi stagnated, so the goal of the treatment would be to soothe the liver and move the chi, so the chi starts spreading out again instead of being bottled up in one place.
Right.
So
Right.
for the digestive system, what are the things that would be you'd see is insomnia. That would be one of the things a person would be have heart palpitation again, dizziness, forgetfulness, excessive dreams as well too can also come from that, because the liver is now overacting on the spleen and stomach. So that creates that kind of
Right.
sensation. Then the next one I have is grief. Grief affects the lung. So when the lung is out of balance, sometimes the emotions of grief is out of balance, or grief that's not been resolved. I mean, it's hard to resolve grief depending on the situation, but a lot of times it can affect the body. And how that can be presented as well too is by way of asthma. The person will have a chronic cough. They'll have shortness of breath, frequent colds and flu, and they feel like extreme sorrow. Sometimes they'll have extreme sorrow that they can't just get rid of. It affects the lung and result in and all kind of lung pathologies, and also including skin conditions. Because one of my experiences and one of the big ones that I've worked on is a patient that came in with psoriasis all over her body. And she's been to every medical doctor she can go to, and nobody was able to get it. Dermatologists, regular doctors, they couldn't figure it out. And so the last step for her was going to a hormone clinic. So they're trying to check her hormones. They weren't getting anywhere. And so they referred her to me. When she came in, the way how we work, because we look at the emotions, that was the first place I looked. Because when I saw that she had a skin condition, it tied in with the lung, because the lung governs the skin, which is the largest organ of the body, right? And so
Right.
when I started interviewing her, when I asked her about grief, she like threw it off a little bit, but I kept coming back to that because there must be an indicator there. And then finally she said, "Well, I have grief, but I'm over it." And I said, "What is the grief, if you don't mind?" And she told me that her dad committed suicide
Mm.
on Thanksgiving 1 year, right? And that was what she was holding in, right? But this is the thing now is every year around Thanksgiving, it exacerbates, and it just
Right.
comes up
It's a
again
repeating
because we
pattern.
never resolved it. So it
Right.
keeps coming back and keep coming back and keep coming back every year, and it lasts for a few months. And I'm telling you, it was bad. Her body was raw. I mean, when she walked in the place, it was smelling like blood because she's scratched all over when she's sleeping. It itches a lot. And when I did the first and second treatment, when she came, I heard this noise in the front of the office, like just somebody was talking loud, and then I need to see Dr. Now. I need to see Dr. Allen. I need to see her now. And I was like, what's going on? So I went up front, and there's this lady ripping her shirt open, pulling her sleeves up, because all her clothes was to her neck and her sleeve, because everything she was covering up because of those sores that were on her body. That was like 50% gone already with just 2 treatments. So she was
Wow.
so excited. She's like never seen anything like that before. So it's not just, it's not just the physical aspect of the body, because see, they did everything that they could do physically and it wasn't addressing the symptoms until you just hit the nail on the head by treating the emotions. So
Right.
that was
Yeah.
one of the biggest testimonials that I've gotten. She was like, I'm putting it on Facebook, I'm telling everybody. So she was able to meet her goal. But so with being able to travel,
Yeah.
she wanted to travel with her coworkers on a cruise, and she was able to do that. So yay to acupuncture, that helped her
Yay to
condition by fixing the
yeah.
emotions. Yeah.
Yeah.
So and another
It's so,
thing, my own
I love
experience
stories like
too.
that. It's so amazing. It's so heart filling because I mean, I've had situations like that also in my practice, and
Yeah.
it is miraculous. It's on the level of miracle. But when
Yeah.
a practitioner, a doctor or a health professional takes the time to go
Yeah.
deeper into that, like what
Right.
is here
Right.
that has not been
Yeah. Here's
revealed?
and the
What is it? There is
mhm.
something. There's something. There's something. And then you
Yeah.
take the time to do that and know like how to pinpoint that. It is on the
Yes.
level of miracle. Yeah.
Yeah. And then even with my own experience, Dr. Nene, is that with regards to the grief, I had a son who passed away in 2018. And I had my actual own experience of that. I didn't get a skin condition, but I ended up having a cold. It's like a cough that just kept coming and kept going. And the same time when we went to Jamaica, because he died in Jamaica, the girlfriend he was living with, she came down with the flu just out of nowhere. And she was in bed for like a week because she couldn't get over it. She didn't understand it. At that time of the year, yeah, it was we buried him in April. At that time of the year, she never had any issues. And just before that, she had that. I was coughing. My daughter, she was starting like sniveling and sneezing. So it's like the grief was presenting itself from all different aspects from everyone,
Yeah.
differently. And that's
Yeah.
how I've realized that. And then there was another lady too who had a son passed away and never really got over it. And she would always come in with always having allergies. She always had allergies. So this was when I was in school learning acupuncture. And her allergies they came to the conclusion that the allergies was from the lung, because the lung of the grief that she had was never really taken care of. They never found out the person that killed her son, and that was like unsettling for her. So she never was able to like put it at close that part. And because of that, she always ended up having, so they had to end up treating the emotions behind all of that stuff and to help her. So yeah, it plays
Right.
a big role
Yeah. Yeah.
in the body.
Definitely. Yeah.
Now the next one is fear, and fear affects the kidneys. And I also have my own experience of that, because I had no idea at the time, because I was a child and I didn't know that fear, what I knew. I was afraid because of the lifestyle that, I was living in. I was in a foster home and they were really mean to me, and there would be beatings and stuff. So it's like you get used to that and you're afraid of doing anything. So I lived my life on fear, and I started wetting the bed and I didn't even know why. And they took me to the doctor. They gave me all this different medication. Nothing was working. I would just wet the bed in my sleep. I didn't know. And then when I started studying Chinese medicine, it just came like a big haha moment, because the pieces of the puzzle were suddenly put together, because fear weakens the kidneys. Who would have
Yeah.
thought? Fear
Yeah.
weakens the
Who would
kidney. When
have thought?
somebody gets afraid, they will wet themselves, because that's
Yeah.
when the kidney energy just goes down, it descends, and it just lets go of the bladder, because the kidney and the bladder work together. And so that was even for me, an eye-opening experience for myself, looking back and saying, oh my God, that was where that was coming from. I had no idea. So yeah, so shock. And so these are the things that you'll get now from the kidney. You'll sometimes have heart palpitations, because in Chinese medicine, the heart is a big deal. In Western medicine, the heart is a big deal. But in Chinese medicine, the kidney is the big deal, because the kidney interacts with all of the other organs.
Right.
Okay.
Yeah.
And it plays
And
a
it's a big
role in every
detoxifying
single
organ as
organ.
well, right?
Huh?
The skin, the kidneys, it's a big detoxifying organ as well because you're getting
Yes,
all
for
that
sure.
toxin
For
being
sure.
eliminated from the body. Yeah.
Yeah. So it affects, it can have heart palpitation as well too, involuntary urination, that's what I just talked about, back issues. So a lot of times when patients are coming in with back pain, we start looking at the kidney, because the back pain is also a back and knee and joint pain is usually indicative of kidney being out of balance. Menstrual disorder and sexual disorders, all these things are under the kidneys. Because if you think about it, in Chinese medicine, the kidney governs your hair, your hearing, right? Your bones, your teeth, your joints, reproductive, and your brain. All these things are governed under the kidneys in Chinese medicine. So when somebody comes in with any kind of those issues, those are the first, that's the first organ that you're going to look at. All right, so the next one is like fright and shock, which works alongside with kidney as well with regards to fear. And fright primarily affects the heart as well too, and it's felt from the prolonged period. If it moves, if you have it for a consistent amount of time, like a fright or shock, then it starts affecting the kidneys as well too. So the fright now, it confuses the energy and scatters the chi. So the chi is not able to be, where it's supposed to be, like scatters it. And with that, you'll get the heart palpitation, poor concentration and memory, waking up suddenly and possibly about 5 a.m. And also indecisiveness and confusion. Sometimes people, you have a hard time making a decision. That's usually sometimes from that, and also could be coming from the gallbladder as well, because the
Right.
gallbladder and the liver also does that as well too. So excessive stimulation or severe trauma and bad emotions, all of these things can reverse the chi from the way it's supposed to go. So for example, when somebody has like digestive issues and they have like nausea or vomiting, the stomach chi is supposed to go downwards, right? But when something like that, it obstructs the direction of the chi, and then the chi starts coming upwards, and then you'll get that sensation in your throat, or you'll get nauseous, or you throw up, all this stuff, because the direction is perverse. It goes in the opposite direction. So basically, those are all the emotions
Yeah.
that gets
Just wanted to say,
affected.
like, during the time of, COVID-19, like so many people are in that stage right now. I mean, it's just kind
Yes.
of the shock, the chronic condition. We will do another session on this in terms of maybe how all this relates to COVID-19, because people are having
Yes.
like long COVID, where they're
Yes.
recovering from COVID, but they're never really recovering. And so it's affecting all of the different organ systems as well. And I
Right.
really attribute that to this, the fright and awe, because it's happening in such
Yes.
a time, the whole body goes into this shock where,
Yes.
this cascade of inflammatory hormones, and it's affecting
Exactly.
every organ system. And so they're having
Hmm.
long-term repercussions, whether it's neurological, whether it's emotional. Um, the body is being affected long term,
Yeah.
and it's affecting people's immune system long range. So
Exactly.
we'll definitely have to pick this up for the for the
Yeah.
for
And
the
there's a
listeners.
lot of people, and I'm seeing a lot more patients now for stuff like that now too, because just the uneasiness and living your life like you never know what tomorrow's going to bring. It's like everything is just so thrown off. We're so used to being on a steady path, but right now that path is like all out of sync. So it's like
Yeah,
everybody is like, you just don't know. So the body is taking on that as well too. It's like it doesn't know
yeah.
it's all confused. Everything is thrown off.
Everything
So
is
that in
confused.
itself is another good topic, doing that with
Summers,
regards
winter,
to
winter,
COVID.
summer, fall, winter. This last summer, I got the first time in my life a summer cold, and I was so sick for like a week or 10 days, and I
Yeah.
thought, it's a summer cold that's going around. It's like a summer cold. I've never had a summer cold in my life. Summer's the
Yeah.
time, my birthday time. I'm always happy,
Yes.
relaxed, easy. How can I be sick in the summer? So the whole
Yeah,
world
because
is
your
really
immune
new.
system is down.
Yeah.
Yeah.
Yeah. There's so
Your
much of
immune
that
system,
stress.
all of
And,
us are immune system. So the thing to do is to try to work on building the immune system and working a lot on emotions, trying to stay
yeah,
calm, because that throws off the physical body as well too. So the
yeah,
whole goal is to, work on foods that are anti-inflammatory wise that you can eat, that you can
right.
help with that. Working on meditation, that moment of silence and oneness, and also working on deep breathing exercise is another thing. I give my patients deep breathing exercise every single day, especially for the stress. And one of the ones that I do, I call it the 5-5-5 method, where I have them breathe in on 5 counts. You're going to hold it, and you're breathing in through your nose only on 5 counts. And then you're holding it for 5 counts. And then you're exhaling through your mouth only on 5 counts and repeating it 5 times. And you
Right.
would be surprised to hear how many people come back and said, "Oh my God, I'm so glad you showed me how to do that, because I feel the stress is around me, but it's like it doesn't affect me anymore." And that's the magic of acupuncture as well, too. When you do the treatment, these people come in with stress at 9, 10, 20, sometimes they say, and then afterwards, when after like 3 or 4 or 5 treatments, then they're telling you that the stress level has gone down. The situation around them never changed, but the
Right.
handling
Exactly.
of the stress is different. Their body
Yeah.
doesn't see it
Yeah.
like that anymore. So the
I would
breathing
have to say,
technique helps.
I think the most important thing is just centering yourself. And through that, the breathing and the meditation is primary, I think. I mean,
Yes.
no matter what you do, I tell people, focus on the breath and focus on meditation. So completely
Meditation, yes.
we're at that. Because the world around us, we have virtually no control to a great extent.
Exactly.
The only thing we
Exactly.
can control is our response to everything, our
Hmm.
adaptation to the world at large. Yeah.
Yeah. I give
Well,
every
thank
one of
you
my
for
patients get that homework.
yeah,
Breathing exercise and meditation. That's a given, and journaling, daily journaling. Because
right. Yeah,
the more time you spend on gratitude is the less time you spend on all the negative emotions that are negative things around you that's not
yeah,
helping you. So those are the
yeah.
3 exercise mainly. Yeah.
I actually took a seminar years ago, I know I'm going to say 20 or 30 years ago. And the best advice, because he said, if we think about how much worrying we do, the worry in anticipation of something to come, he said, look at a calendar and schedule one day a month, and that will be your worry day.
Oh,
So write down all the things you're going to worry about. And on that day is the day that you will worry about all those things that you've written down. And when you've written it down, you have the whole month to work out all the ways that you can take care of what you think you're going to be worrying about. So the time the
right.
worry day comes, there's really nothing to worry about anymore. But he said, hold the worry, just write down all the things, and then keep that one day. And it's so
Hmm.
fascinating, right? Because we
Yeah.
spend
That's.
so much time and waste so much energy and create so
Hmm.
much anxiety and create those stress hormones. It's like we feel
Right.
like we're always under the gun, and for our immune system, that's the worst possible thing that we can do, is
Hmm. Hmm.
put ourselves in that state. I mean, basically it should be like the ebb and flow. It's like a pendulum.
Ebb and
So we're
flow.
not always in a state, but then when we get really ill, we're always in a state of stress and we never release from that.
Yes. Yeah.
So yeah, yeah,
That's a great idea. I'm going to start
yeah,
writing down my stuff too for a month. I'm going to select
yeah.
one day in the month too and try to do that for myself as well too.
The worry
Because as a
day. The
business
worry
owner,
day.
you know how that is. There's always stress coming at you from all angles.
Yeah,
But I tell my patients and I try to adopt the same thing, it's more in the perception. So don't look at it as stress. Try to find another positive way to look at it. See the good in
right.
it anyways and try to figure it out that way. So that's what I say.
Yeah,
So in
and reflect.
summary, in addition to emphasizing the overall view of the person, the concept of the emotions, I want to highlight also that unity of people is one of the things that we really try to get people to connect and come together, as well as with nature and social environment, because these are all important aspects also of being balanced. So not to forget the nature, how important nature is to us, and without nature we wouldn't exist. So we have to remember that as well. Our animals, as well as part of our living and universe. So all of those things are things that comes together and help us. And
Yeah,
all of these things that affect our visceral, it affects our blood flow, it affects our energy. So everything has to be united as one.
yeah, yeah.
Yeah.
Speaking of which, you're in a harmonious setting, Rosemary.
Oh yes, my mural behind me. Yes.
I love that. I love that.
Yeah.
Yeah. Did you say that you
This
teach
mural,
that?
it always reminds me of like walking in the forest, that path. And that path, at the end of the path, I said that could be whatever you want it to be. It could be
Yeah.
ocean, it could be mountains, it could be whatever. You put your own
With your
piece in
own.
the
Yeah.
back there.
Yeah. And I love it because there's
Yeah,
a
my
light at
patients
the end
love
of
this
the
room.
forest. I want to
Yes.
move. I want to walk towards it and go into the
Just keep
sunlight.
going, right?
But
Yeah, I
you're
love it. The
you're in
patients
a
love
safe.
this room as well too. We call this the green room because its color is green. It's got a really
Uh-huh.
pretty green. I don't know if you can see. Let me see. You see that green?
Oh yeah. Uh-huh.
Yeah. So the
Yeah.
picture just
Beautiful.
runs in it. So,
Yeah.
but
Beautiful.
anyway, thank you so much
Great.
for
Well,
having
thank you
me. And
so much.
it
This
was
has
such a
been really
pleasure
informative.
talking about
You know, I'm
this.
thinking as we're talking, I want to do another interview and a dialogue with you and see how, because, you know, I started out doing my healing form like over 30 years ago in my office. And I base it on some of the Louise Hay, um, you know, the emotions that were linked to the
Yeah.
body. I'd love to kind of compare
Yes.
notes and see how that compares with the Chinese acupuncture system. And maybe
Hmm.
we can also do another session on different types of meditation. There's a few Taoist meditations that I love that I learned
Yeah.
years ago also. So let's
Okay.
continue on with this
Yes. I
conversation. I
love
love it.
this.
Well, thank you
I'm
so much.
happy. I love educating people and teaching them what I know.
Yeah,
I call myself a teacher, and I think that's one of my purposes, for
yeah,
being here is teaching, because I teach all of my clients, because I feel like the more the client knows, the more proactive they are in taking care of their own health,
yeah, definitely.
So
I
yeah.
feel it too. I'm primarily an educator. That's what my role is, to
Hmm.
help you
Yes,
discover yourself. And I say to patients that you are your own best doctor. Nobody knows
that's
you
right.
as well as you know yourself. So now I'm here to help you delve deeper into your knowingness. So
Yes.
yeah, I think that's really the purpose of it. That's what a true doctor does. I mean, educates people
Hmm.
and allows people to heal themselves, you know.
Yes, for real.
Uh, my motto
Yeah.
is make your body a better place to live. And at any age, you
Yes,
can
yes.
create yourself from the
Yeah, I
inside
love
out.
your motto. That's beautiful.
Yeah, yeah, thank you.
And mine has to do with listening to my patients. I always listen to my patients, because the patient don't care how much you know unless they know how much you care. So that's
Right,
my bottom line.
exactly. Yeah. So how can people find you, Dr. Rosemary?
Yes, my website is www.abalancedU, is the letter U, wellness.com. Again, www.abalancedUwellness.com. And my number is 904-479-6529. And I'm located in the Jacksonville, Florida area.
My old hometown.
Yeah.
I
Yeah.
actually moved there in sixth grade. I was there for sixth, seventh,
Really?
eighth, part of ninth grade. Yeah,
Yeah.
Jacksonville.
Wow.
Yeah,
Hmm. I
I
live in San Marco. You probably don't know San Marco area. It's one of the holistic areas in town, and then my office is located in the Riverside, which is like 5 minutes from one to the
ah,
other.
yeah. I didn't travel so much.
Yeah.
I wasn't driving those days, but it was my first concert
Yes.
I went.
Yes.
My Beach Boys was the first concert I ever went to down there. So
Yeah.
the
Well, I'll
Beach
see
Boys.
you here when you come here for our live presentation on our other thing that we're doing.
Yeah, yeah,
Yeah.
definitely. Okay, my dear.
Thank you so
Let's.
much for having me, and have a wonderful
Thank
day. And
you.
thank you everyone for listening. We appreciate
Thank
you.
you. We'll be back.
Bye.